Good morning, Pete Rulon. I want to talk about the process of radiation oncology for the treatment of metastatic prostate cancer. A long time ago, I was diagnosed with prostate cancer, had my prostate out, and had radiation therapy. For 12 blessed years, it basically remained very low level, nothing of consequence. And in the last year, it's popped its ugly head enough to require some attention. So let's talk about what's going to happen if you have radiation on treatment on your prostate. Now, typically, they're going to give you a drug called Rulon depot. That is going to turn your testosterone into zero and suppresses your growth of your tumors. Apparently, clinical studies say that that's going to make it more prone to effective treatment with radiation. The thing that happened when my PSA jumped to an action level is they ran a brand new PET scan. Previously, the PET scan was non-discriminatory. It just sort of said you've got areas where your body's active. Well, apparently there's a new radioactive compound that they use that targets PSA cancers. So you go to a center that has availability. They actually had to drive my drug from Raleigh down to the shore, and then they inject this into you, and then they run a PET scan, which is basically a radioactive counter that the table goes in, and it does slices counting where the radioactivity is located in your body. Now, because this is fairly specific, those areas that show a high level of radioactivity are typically cancers and prostate cancers. And this new diagnostic test is much more sensitive than the just plain old PET scan. So for me, they found 3 locations of cancer. 2 in my pelvis, not unexpected, and the third one was here in my neck. Sort of a surprise. Now, both those 2 are in the lymph nodes, and this one is in another lymph node. Well, they were not 100% sure that this one in my neck was prostate. So what they do is they bring you in, they numb you, so you don't feel anything, and it's all topical, so there's no kind of putting you out for this, at least this biopsy. And they take an ultrasound wand and they kind of run it around until they find the area where the tumor is located. Now, in the ultrasonic wand is a hole down the center. So they run a needle down there and they insert it into the tumor area, and then what they call a snap a plug. You'll hear a snap, and you might feel just a little something, but there's not a painful event. It's just Novocaine, which I don't like. But they'll snap out a bunch of plugs. They'll send that to the pathologist, and in my case, yes, I do have prostate tumor in my neck. So the decision was to proceed with radiation oncology. Now they, for reasons that I don't understand yet, but I will, they decided to do the 2 in the pelvis first and then the 1 in the neck. The process for the 2 treatments is almost the same. They bring you in and they run a CAT scan of the area that they're going to hit with radiation. That is so when they set up the device that irradiates your tumors, they know how to line it up so the beam goes where it's supposed to. So they run the CAT scan, and they'll actually put some marks on your body, which are alignment marks. Apparently in the CAT scan and in the device that irradiates you, They're little laser markers that allow them to roughly line you up so they're hitting the right spot. So you get marked with these alignments. Now for the pelvis, they created a mold to make sure that kind of kept my pelvis and my legs steady. And if you've ever received a package that's kind of odd shaped and they put in a packing where it molds around the contents of the box, that's what they do for me with my hips and legs for that treatment. So when you come in, there's a table in front of the machine. You hop on the machine. They rough align you. So you lay in there, and the machine, they move you in the machine, and out of the side of the machine opens up 2 panels. Well, this is an X-ray. So they spin the machine until they can do a horizontal X-ray and a vertical X-ray. And although they've lined you up with the lasers, they tune up your position based on the X-ray matching the CT scan, so they're comfortable that they have properly aligned you. And so they'll run that, and then about 30 seconds, 40 seconds later, you might feel the table you're lying on get bumped a little bit just to perfectly align you for the radiation treatment. Well, this big old device spins around to the first position that it's going to irradiate. And they have, I had a ring that I held to keep my arms comfortably on my chest, and I'm laying there, and they don't want you to move, obviously, because they don't want the radiation going somewhere else. And the machine comes, gets to a certain point, and you hear a clunk, and that's basically a relay dropping. And you may hear a slight buzz. Now, in the pelvis during treatment, I rarely felt anything. Didn't feel warmth. Maybe every once in a while you hit a nerve and you sort of, it didn't hurt, it just, you knew they lit up the nerve. But that was momentary. And then it moves to the next position, moves to the next position, moves to the next position, and goes through the pre-planned radiation protocol. Now understand, just as an aside, in the actual head that does the radiation, that's what's called fingers. And those start off so just the center is allowing the beam run through. You get the center, then partly through the radiation you could hear the fingers move, and that's opening up the beam. So you get a heavy dose right at the cancer, and you get a lighter dose surrounding the cancer. So you go through the protocol that the doctor's written for you. You come out of the machine, and maybe this treatment was 15 minutes from start to finish. And for that, the pelvis area, I had 5 weeks, 5 days a week. A little bit of a pain driving. The challenge that I did not see in the original radiation, which was right in the pelvis area, these are spread out farther in the hips, was that I irritated my bowel. And it kind of felt like when you've got diarrhea, you get that cramping, that intense cramping, and the cramping makes you mildly nauseous. Spoke to the doctor. He gave me a drug that just 5 minutes later, all that stuff calmed down. And for the first 2 weeks, I took the drug 4 times a day. And then as treatment progressed, these symptoms diminished, and I didn't have to take it as often. I might take it once if I started to feel a little off. One of the really important things is you're going to take probiotics. You're hitting the bowel area. you're damaging the bacteria in the bowel area. So you need to refresh that bowel area.